The Webster Technique is a gentle technique performed by chiropractors to help with labor and delivery. It can also help with positioning for a breech baby. Watch the entirety of this video for many variations of this technique. Here we're showing the initial assessment, checking for the tension that we feel from the pelvis and the surrounding soft tissue. As you can see in this specific video, it is that left side that is more tense and tauter than the right. This ends up being the side that we adjust. An adjustment is a quick movement that is used to get a beautiful physiologic response and relief for the patient. Here the doctor is utilizing the drop piece, which is a tool that kicks up underneath the patient to allow a beautiful drop through the pelvis, creating mobility without too much rotation and really allowing movement through that pelvis. Back to the Webster technique, it aims to restore the proper alignment of the pelvis and sacrum to ensure optimal baby positioning for a smoother and easier delivery. In saying that, adjustments and movement, like you'll see in this video and in our chiropractic clinic, decrease labor and delivery time by 25% or more. And it's more when it is subsequent pregnancies, but it's because the pelvis alignment is so important for labor and delivery. The Webster technique involves gentle adjustments to the sacrum and pelvic bones, which we have demonstrated in the videos already, as you've seen, as well as the surrounding muscles and ligaments. This technique is safe for both mama and baby, and it has been shown to reduce the likelihood of breech and posterior positions during labor. So you will hear this as a technique used to flip a breech baby. When we are working with a mother who is dealing with a breech baby, we are not doing anything internal or invasive. It is just what you're seeing here. It's on the outside, working on the muscles and ligaments and the joints and creating more mobility and better alignment. In this particular portion of the video, the doctor is working on the Sacrotuberous Ligament, which is a very important ligament related to labor and delivery. It goes from the sits bone to the tailbone, so it is very directly related to the tailbone. And the tailbone is a big player in labor and delivery. Its movement actually helps dictate engagement and how you move in and out of labor. So it's a big player in baby's movement, dropping down for labor and delivery. Typically, when we are performing the Webster technique on a pregnant patient, we are working on one side versus the other. So we are adjusting through the sacrum, which is the upper portion of the pelvis. We are working on the opposite side Sacrotuberous Ligament, which is that ligament that goes from the sits bone to the tailbone. And then, as you'll see in the videos further along in this video, we then start to work on the front side for the patient, the Round Ligament, the Pubic Symphysis bone, and the Iliopsoas muscle. When we are working, we are spending a lot of time. It's all about holding and letting these ligaments and tissues release. So you can imagine for the patient, this ends up feeling very relieving and very comfortable. In addition to the alignment components of the Webster technique, it can also help to alleviate common pregnancy-related discomforts, such as back pain, sciatica pain, tailbone pain, pubic symphysis pain, round ligament pain. It's recommended that pregnant women seek out a chiropractor who is trained in the Webster technique to receive this appropriate care. Everybody in our office is certified and practices this technique on the daily. I will also say that not just being certified is enough in regard to what we see in our specialized niche care in our office. It's important to seek out somebody who is practicing this on the daily, who really understands the intricacies of pregnancy and the adjustments that are associated with pregnancy, because it's all about the comfort for the patient. And if the doctor isn't set up to supply a lot of comfort for the patient, it can make these adjustments and these maneuvers much less comfortable and it could change the outcome. Here you're seeing the doctor work on the patient while she's on her side. So instead of using that drop piece that you saw in the beginning of this video, you're seeing her adjust through the pelvis with the patient on her side. It's important to understand that this is safe and it is effective and it creates incredible outcome. But again, you want to have a doctor who is very comfortable and very well versed in pregnancy care working on a patient's side like this, because you don't want to over rotate or get too much stretch. It can be common for a patient to get sore if they are overstretched in this particular side position. So you just want to make sure that A, as a patient, you're talking to the doctor and making sure that they understand how comfortable or uncomfortable you are, and B, that your doctor very much understands how to be adjusting on the side like this for the Webster technique. Here you're going to see the doctor demonstrating work on the front side of the body. So as we discussed earlier, on the front side is the round ligament, the iliopsoas muscle, and the pubic symphysis bone joint. Here the doctor is working on the iliopsoas muscle. She's showing the patient how to move the leg to get a deeper stretch while she pins the muscle belly. So when you do that, you get a longer stretch and a lot more relief through this particular area. This muscle attaches on the front side here where the doctor is compressing, but then it also wraps and attaches to every low back vertebrae. So work on this particular muscle will also greatly benefit the low back and the SI joint on the back side. Here you can see the doctor demonstrating this iliopsoas stretch with the patient on their back. Again, important that the patient is on a wedge and not flat, but this is the same muscle. Here you're going to see the doctor working on the round ligament. Important to note that this is a different patient, and so it's on the same side that you saw in the previous video, but it's for a different part of the body, which is the round ligament. When working on the round ligament, there isn't as much movement. It's more about relaxing through the ligament, letting the tissue totally lengthen and relax and kind of melt under the doctor's hands. But you'll notice that the patient's arm is high and the patient's leg is back behind the table, again, just to create length. Also something that you can do stretching wise at home. And again, we have more videos on that on our YouTube channel. But for all intents and purposes, with the Webster technique, this is just another way you can get to the round ligament. This is getting to the round ligament and working on the round ligament with the patient on their back. Again, wedged up so they're not flat, and just relaxing the tissue, letting it melt under the doctor's fingertips. Here's another example. Again, not invasive, very relaxing, very nice, very calm, very comfortable for the patient, and it creates a lot of release in pressure in that area. The last adjustment and component of the Webster technique is adjusting through the pubic symphysis, again, related to what we saw with the tension on the backside. There are two versions of this, using the hand or using what we call the activator.